Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 3 additional deaths due to COVID-19. One from the Northern Health Region, one from Paramount Health Region, and one from the Winnipeg Health Region. I want to extend my condolences to their families, to their friends, their loved ones, their caregivers. Our current 5-day COVID-19 test positivity rate is 10% provincially and 8.8% in Winnipeg. As of 9:30 a.m. today, 133 new cases have been identified, taking our total to 26,450. We continue to update our active case information, reviewing older cases and close the number of them to more accurately reflect the number of active cases we currently have. You'll notice that our active case numbers, both in the total and in the number of hospital, have been updated through this process. Today's numbers are encouraging. We definitely want to see this trajectory continue, and these numbers are a testament to the hard work of Manitobans following the very tough restrictions that are in place, but necessary, and we see some of the benefits from that at this point. We're certainly not back to normal, we're not out of the woods, but we are seeing the trajectory that we were wanting to see. We need to continue to have Manitobans still put in that hard work to limit the transmission of this virus. We need to ensure we're going to continue to decrease the impact on our healthcare system so we can get back to the healthcare needs to provide to all Manitobans. We could be even in a better place right now, but we did see a lot of the gathering over the holiday season. We know that was a real challenging time for Manitobans. So as of this morning, we have 538 confirmed cases that were identified on or after December 25th that our contact tracing indicates have been related to gathering during the holiday season. And those cases are linked to 2,879 contacts. So these high numbers, nearly 3,000 people just from those gatherings now in self-isolation, a certain proportion of which will become cases. But this is really, why we needed to extend the restrictions we have in place. We have to still see what the impacts of this holiday gathering was. We all know that these restrictions have been quite difficult on Manitobans, and especially those businesses that have had to close. And it's been a long haul with these restrictions. And so we've heard from businesses just how difficult it has been for them, and hearing from other businesses that despite the public health orders, they plan on opening. And I think that it's again a reminder on why we have these restrictions in place. We saw that trajectory in early December, that we were going to see up to 1,000 cases a day in early December. We were predicting that would in fact overrun our healthcare system. We just couldn't have that occur. So we had to put in these very tight restrictions, and you could see that the trajectory has changed. And it's changed because of those restrictions. And so we're not out of the woods. We still need these restrictions in place. So definitely we're in a better trajectory than we were back at the end of November and early December, but we're not out of the woods. So we need these restrictions in place. If we open things up too soon, if we have Manitobans that are not following the public health restrictions or public health advice, we'll see those numbers come back again, and it'll again extend the need for restrictions. So we certainly understand the implications of these restrictions, how tough it is on probably all Manitobans, certainly tougher on certain Manitobans, but they're absolutely necessary. So the public health orders are in effect, and businesses that open up and contravene those orders are subject to fines. And so we've never wanted to take that approach, right? We've always wanted that educational approach, but at this stage in the pandemic, it's quite clear what the orders are. And so I'd really encourage everyone to continue to follow the restrictions. We're really planning on getting these numbers down and start again gradually lifting some of these restrictions. So I'm still going to ask Manitobans to adhere to the public health advice, which has been able to change our trajectory quite dramatically. Also concerns about the NHL being able to play in Manitoba and through Canada. And again, noting how important recreation is to certainly our young Manitobans, but to everyone. And so probably some disappointment for people who see the NHL being able to return to play, but youth sports not being able to return to play at this point. We will be able to return to that, but just not at this point. And so while it's frustrating, I think we should all be clear that that's a substantially different set of circumstances. We're talking about a league that has very strict guidelines in place. So these players are going to the rink and home or to the hotel, and that's it. So really no exposures to Manitobans outside of that. And then again, very strict measures with daily testing. So we just don't have those safeguards in other levels of play. Right, we won't have parents and children only going to the rink and home. They'll be out to work or to school, amongst other things, and certainly wouldn't have the ability to privately contract testing every single day. So while it's disappointing, there is a reason why we've decided that this is very little risk to the public and allowed to go ahead. But keep in mind that we're continually reviewing the need for these restrictions. We want to get people back to this recreation as soon as we can. So we will do that. But just right now, we still need to see the effects of these holiday gatherings. We need to do things gradually. So while we see these numbers today, we certainly like seeing the numbers traveling in this direction. It should be clear that we're not out of the woods, that we have many people that were exposed during holiday gatherings that still might become cases. We can look around to other jurisdictions, even in our own nation, that are seeing trajectories in the wrong direction still. So we're still at risk, and we need to stay focused to decrease the amount of transmission that we're seeing. We need to continue to relieve the strain on our healthcare system so we can get back to things like surgery. That's just starting to get back this week. And so the message right now stays the same. We want to protect ourselves, the people around us, our loved ones, our community, our province. So that's a stay home. Stay home when you're ill, for sure. Get tested as soon as symptoms develop, even if they're mild. Self-isolating when you have symptoms. Even if a member of your house is ill, we would suggest that all Manitobans in that situation stay home pending that test result. Washing hands, physical distancing, all these fundamentals are still in play at this point. And so ask all Manitobans to keep up the hard work. We know these are sacrifices, but our numbers now compared to November and December are showing the effects of that hard work. So thanks again to all Manitobans. I'm going to pass it to Lanette.
Thank you very much. Good afternoon, everyone. The acute care capacity continues to be able to meet the current demands. There were 316 COVID patients in the hospital as of this morning. This includes 162 patients who have active COVID infections, as well as 154 who are past that infectious transmission stage, but still are requiring inpatient care. As Dr. Roussin said, these lower numbers are reflective of the work that happened over the weekend to clean up the data backlog, but it's also a reminder that COVID patients may get sick and need to go in the hospital, but they also may need to stay quite a long time because the effects of the virus do impact them longer term. As of midnight, there were 105 patients who were in our ICUs, and this is still 33 patients over and above what our normal pre-COVID ICU capacity is. However, we are cautiously optimistic that these numbers have stabilized and they're slowly and steadily going to go down. So we're watching that carefully and managing accordingly. Within the ICU, there are 37 patients who either have COVID or have passed their COVID infectious period, still though very sick. We have 23 out of the 51 patients who are on ventilators this morning who have COVID, and this includes 11 patients who have passed that infectious period. While COVID-related hospitalizations continue to skew towards older adults and seniors, I do want to remind everyone that this is a virus that infects all demographics. 35 patients currently in hospital for COVID are under the age of 40, and this includes 5 patients who are under the age of 20. Meanwhile, more than half of the COVID patients in our ICUs are under the age of 60. These numbers demonstrate the continual need for all of us to remain vigilant and do everything we can to be safe and mitigate the spread of this virus. Our alternative isolation accommodation program has been working all weekend to assist other regions who are currently experiencing outbreaks. This includes Prairie Mountain Health, Samaritan House Ministry, Safe and Warm Shelter, which is in Brandon, as well as several communities in the Northern Regional Health Authority. So these outbreaks are emerging right now, and we will continue to work collaboratively with our partners across the province to make sure that these individuals, these either active cases or contacts, are provided a safe place to isolate in the coming days. The amount of sick time that is used by staff, specifically in the Winnipeg Regional Health Authority, continues to trend in the right direction. Approximately 102,000 hours in the Winnipeg Regional Health Authority were lost to sick time in the most recent 2-week period, which is an improvement from the nearly 5,000 hours from the previous pay period and 10,000 hours better than our peak, which was in late November. However, this sick time does continue to pose a challenge to us, and it is far above the 5-year average of 85,000 hours for this comparable pay period. And to give you some perspective, 102,000 hours of sick time amounts to nearly 6,400 8-hour shifts per week that the health system needs to replace. And this is nearly 1,100 shifts over and above the average for this time of year, which places obviously a significant strain on our staffing resources. And there are many reasons why people may be sick, not related to COVID, but also given the pandemic. They may be contacts, they may have been exposed, and they may be on isolation or be active cases. So we continue in our pursuit to make sure that it is easy for staff to get themselves tested. There are several testing sites throughout the province who are dedicated to scheduling the tests. There's the rapid testing. As well, we continue to modify our PPE protocols to make sure they're current, and the PPE that is necessary is accessible, along with fit testing, and of course the vaccination strategy. And just finally, two quick notes. The first is the emergency department in Morris reopened this morning. Emergency services at that hospital had been suspended on December 8th because of an outbreak, and it was declared over last week. And second, as we noted on Friday, additional surgical slates continue to be explored. They are being scheduled this week at Health Sciences Center, Concordia, Misericordia Health Center, as well as Pan Am Clinic, so that we can address some of the elective and non-urgent surgical cases that need to be performed. Southern Health Santé Sud is also intending to increase surgical slates starting next week at Boundary Trails Health Center, Portage District General Hospital, as well as Carmen Hospital. So these slates will include their urgent and semi-urgent surgeries, as well as some non-urgent and elective as they can be prioritized. So patients can be expected to be called from their respective providers as to if they are going to come for surgery and what needs to be done to prepare for that. And hopefully we can continue on that trend as we see the hospitalizations decrease and staffing situations stabilize. And with that, we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions. Up first this afternoon from CTV Winnipeg, Michelle.
Hi, the first question is for Dr. Roussin. Why can't personal services like tattoo shops, piercing shops, hair and nail salons open?
Yeah, and so right now, we were in a place where we needed to have very tight restrictions. We were at a place certainly in early December, where we were in a trajectory that would overwhelm our healthcare system. And since then, we've seen a very gradual improvement. But the message was we needed Manitobans to stay home, to only go out for essential purposes. And so with those orders in place, we're in a position to reopen surgeries. We're in a place to, again, review and engage Manitobans on what further reopenings would be. But as of right now, we needed to have these restrictions in place to limit the transmission of the virus, and you could see that it's worked.
Okay, thank you. With regards to the cases over the holidays, can you elaborate as to what sort of gatherings these people were at? Was it, one family coming over to another's for dinner, parties? What are people reporting?
Yeah, it was a large range. Some of them are just that. One family coming visiting another. Some of them were quite large, where we've had over 20 people at a house for that. So these are all mostly gatherings in private residences, and it ranges just from a few people coming over to rather large get-togethers in the 20s.
Okay. And then with the vaccine rollout, we saw some long-term care home, the first doses going out today. How many are we expected at the end of the week? And also, how many total Manitobans are we estimating to vaccinate by the end of the week?
Yeah, so I think there's going to be a vaccine bulletin coming out later that will address some of that. I don't have the specific numbers. I think that seeing that vaccine roll out into the personal care homes, some of the most vulnerable Manitobans starting to receive that vaccine is, I think, showing us some of that hope that we can all look to. And we feel it's, quite important to get that vaccine into as many of those vulnerable Manitobans as quick as possible.
From City News, Jonas.
Good afternoon, folks. Just going to follow up on vaccines with Dr. Roussin, if you don't mind. There's a new poll out from Angus Reid. I guess over half of Canadians are now saying they believe the amount of time they're going to have to wait for a COVID vaccination will take too long. Manitoba, one of the most pronounced provinces on this. There was some dissatisfaction with speed being distributed. Just your thoughts on the rollout, and I guess just a message to folks about their expectations about the vaccine.
Yeah, and so right now the limiting factor is the quantity of doses. And so the vaccine rollout is going as planned. We're getting the vaccine to, to the priority groups, healthcare workers, now personal care homes. We're expanding the eligibility to ensure we have enough demand for the supply we have. So it's rolling out. We're going to be opening up that next super site in Brandon next week. And so right now the limitation here and in every jurisdiction is the quantity of the vaccine. As we get more and more quantity, we'll be able to provide that and open up the eligibility criteria more. Really if we're going to get out of this pandemic, we need the majority of Manitobans to get this vaccine. So I'd encourage all Manitobans, when your eligibility comes up, to get that vaccine as soon as you're eligible. That's when we're going to start getting that herd immunity effect. And, hopefully in the fall of this year, and we're going to be able to see life at least more back to normal than it certainly is right now.
Just to follow up, if you don't mind, sir, on the mentality around the vaccine. I know myself, I'm just thinking back to, mid-November and how dire our situation was, and to think that now we are actually seeing our personal care home residents being vaccinated today. You're just a message, I guess, on the mentality around vaccine and how we should think about it.
Yeah, part of the issue with vaccines, in a lot of circumstances, they're a victim of their own success. They've worked so well on many of the diseases that they prevent that people don't feel at risk to those diseases. And then over time, you sometimes see vaccine uptake diminish. And so I certainly don't want to see this with COVID-19, that our restrictions are working, the numbers are coming down. We're going to be vaccinating the most vulnerable and at-risk Manitobans first, and then moving back into spring and summer where we might be able to expect some seasonality. I don't want us to let our guards down. I want as many Manitobans to get protected as soon as they can, because come fall time, we want to start getting back to normal. And we can't get back to normal unless we're getting close to that herd immunity number. And that's going to rely on Manitobans to, in a way, do your part to get that vaccine. It protects you, but it also protects all the people around you. So my strong encouragement is for all Manitobans, as soon as you are eligible, do get that vaccine.
As a final follow-up, sir, on the numbers today, just looking back this weekend as I was just browsing through some stuff and looking at the trends we saw from Thanksgiving to, say, this point on, about 16, 17 days post, we had seen a doubling of our numbers. In this case, we're actually going down. I guess maybe just a message to Manitobans about their efforts over the holidays, even with the gathering sizes. It does seem that perhaps maybe more followed than we thought.
Yeah, I think that all along the majority of Manitobans have been doing their part and sacrificing and doing their part to keep our province safe. We did see some of these numbers, these gatherings, which was reason for concern and still is. We still have nearly 3,000 contacts from those gatherings that could still become cases. But absolutely, we want to see our numbers tracking down. We're not seeing that upward trajectory at this point. So definitely cautiously optimistic.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, you mentioned that this week sometime you're hoping to find ways for Manitobans to give feedback on the public health orders. When can we expect this to happen, and what is the province hoping to discuss?
Yeah, I don't have the detail and the timeline. I do think that we're trying to do that as soon as we can this week. And with that, we want to have a well-developed type survey and sort of get some information from Manitobans. We're looking to see where Manitobans' priorities are. So we're really following these numbers and really hope to be in a position to loosen some of the restrictions. So we want to hear from Manitobans where the priorities are, with which things we should lift, because we do have to make choices, right? We're not going to be in a position to just lift everything at once. So we're interested in hearing Manitobans' priorities and then engage in that regard.
And when it comes to businesses in Manitoba, what needs to be done for them to reopen, both on the macro provincial level and the micro level with the businesses themselves?
Yeah, so I think that this engagement is one of that. We want to hear from Manitobans, hear from business owners and operators. Our intent is to try to give notice, try to make a decision, try to give some period of time on when the restrictions are and what restrictions are going to be lifted at a certain period of time to give people time to prepare. And then online, we've already had public health guidance for businesses on how they can operate safely.
And this weekend was quite warm. A lot of people were outside. Have you seen pictures of people crowding places like parks or the forks? And are you concerned with these crowds?
I can't say I saw pictures, but anytime you have a crowding, a large number of people, then it increases the risk somewhat. That's why we have the group size restrictions. I think that it's great people getting out, staying active. There are lots of benefits from that. I would still encourage Manitobans to watch those group sizes. If you're out with your family, try to ensure you're not grouping with other, even outside. And this is in a relatively short period of time. We're hoping to get back to these type of activities, but in the meantime, just watch those group sizes even outdoors.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, I was wondering, has the province hired a provincial COVID immunization director yet? And if not, what is the deadline for filling that position?
Yeah, you know what? I don't have details on that. I'm not sure if that might be something that's in the bulletin, or Dr. Reimer will be out, on the phones tomorrow and on Wednesday. Might have some more information on that for you.
Can you describe how many positions, immunizers, clinic staff, etc., are how many positions still need to be filled to get the immunization campaign up to speed where you'd like to see it at?
I don't have the details on that. I know that there is a number of our healthcare workers who are stepping up for that, and we're quite grateful. And I think there's a process in place right now to try to get that, get those positions filled. As far as specific numbers, I don't have that. I don't know, Lanette, did you know?
Okay. Do you know then, another vaccine question hopefully you can answer, how many eligible healthcare workers have been vaccinated so far, and by comparison, how many who are eligible have not taken the vaccine?
That's a tough one, to measure the cohorts, especially as we keep expanding the cohorts, and they're by age. So I don't have a specific number on vaccine uptake. I know we've administered, as far as dose-wise, over 10,000 doses to date, but later on today there'll be some more specific numbers in that bulletin.
From Global News, Marnie.
Good afternoon. Dr. Roussin, my first question is about people reporting gatherings or other violations of the public health order. We're hearing just as slow response times from health inspectors, and that the provincial reporting line is closed on weekends. Why aren't people able to report 24/7? And wouldn't it kind of defeat the purpose, given that gatherings are likely happening on weekends or late at night, and by the time it's reported to health, the gathering has dispersed?
Yeah, I mean, we have to have some, reasonableness with this. There's a lot of reports that come in, and again, we're interested in, really large gatherings, but often, we just don't have the capacity to be out, investigating where somebody is thinking there's too many people on a pond skating. So I think that, we have to balance this. We want Manitobans to be able to report it, and they do, and we do investigate it. But it's not run as for instance, a 911 system that we would have a health inspector out at every opportunity to look at things. So we have the restrictions in place. People can be fined and have been fined. And we do have a process in place to investigate, but it just can't be operated as an emergency operation.
Thank you for that. And just on schools, are we still anticipating grades 7 to 8 are going to be able to head back for in-class learning on Monday, the 18th?
That's still the plan. Our numbers are better now than they were in November and December when we had the kids back in school. A lot of safeguards, a lot of great work from our education colleagues and operators. And so we think that the safeguards that they have in place are keeping our kids safe. And so there's so much benefit having the kids back in school. So I do, at this point, expect that. Of course, we're always going to do what we think is the best for Manitobans and for different populations of Manitoban. But as right now, we haven't decided on changing that.
Thank you for that. And lastly, have we seen, in the recent cases, have we seen any cases of the variant here in Manitoba?
No, we have not detected that variant in Manitoba as of yet.
From the Brandon Sun, Michelle.
Good afternoon. I'm wondering how and where are clients from Brandon Samaritan House and Safe and Warm Shelter being accommodated following the outbreak being declared, and how many clients have tested positive and how many contacts?
I don't know. Do you know what those numbers are in terms of contacts?
Not on the total contacts. I believe there has been 5 staff that have tested positive.
Okay. So I think that's an evolving situation. I have been getting regular updates throughout the weekend and this morning. So my understanding is that Prairie Mountain Health leadership is working with the shelter as well as the community leadership, the municipality, and certainly we'll be working with them as well to find isolation space, whether that be in Brandon or if they need to come to Winnipeg, which probably wouldn't be ideal for them, but it is an option if we need it. We will make sure that there's capacity for them.
Okay, thank you. I'm also wondering at what point does the province consider an outbreak over? For example, at the Brandon Correctional Center, it's reported that the outbreak is down to 1 active case. So when is something over?
When we declare an outbreak, we'll typically declare it over when there hasn't been a single case for an incubation period, so 14 days. So we need all the cases resolved and 14 days to pass without another case, then we'll declare an outbreak over.
Okay, thank you. I'm also wondering, at this point, are you collecting data regarding long-term effects of the virus? And do you have any specifics to share on that?
It's not a reportable illness for public health, so public health is not collecting that data. There certainly clinicians are following clients, but public health won't have data on that at this point.
From CJOB, Will.
Good afternoon, everybody. First question could be for either of you, I suppose. Cases of influenza way down this year. I believe only 1 case has been reported so far this season. So what lessons could we take away from a health perspective or otherwise from this flu season? And does this show us anything about previous years?
Yeah, I think this respiratory virus season has been dominated by COVID, and we couldn't predict that going into it. We were planning for co-circulation of the typical respiratory viruses, influenza, RSV, and we're seeing very low numbers of other viruses. That probably explains a lot of why our test positivity rate has remained high, because people who are getting ill, it's almost all COVID. And so the practices that we have in place, the physical distancing, the hand washing, the staying home when you're ill, the restrictions, work really on all viruses that are spread in the same manner as COVID, which these all do. So we can see that things like masking, staying home when ill, will probably be beneficial will definitely be beneficial in years moving forward. I think that we've accepted too much of people coming to work when they're ill, and during typical flu seasons. I think we could do better and reducing even the impact of flu with some of these fundamentals.
Okay, thank you for that. Dr. Roussin, the spread of the virus in Canada has been described as a bit lopsided. Ontario posting a record, 4,000 some new cases, while in Atlantic provinces it's around a dozen or fewer. So in the longer term, if these kind of trends continue, our numbers going down, other provinces going up, would you ever consider implementing some sort of domestic travel restrictions? Is that on your radar?
Well, we've, our typical answer, we don't take anything off the table. We're going to look at things like that. We still have some domestic travel, not restrictions, but the requirement to self-isolate from East of Terrace Bay. And so we'll keep looking at that epidemiology. Certainly those type of restrictions have significant impacts other than just limiting the virus. So we carefully consider those things, but right now we don't have immediate plans for that.
All right, thanks. And final question for Ms. Siragusa. Are the numbers we're seeing right now having enough of an effect on our hospital capacity, or is the strain easing quite as quickly as you had hoped?
Well, we still are over capacity. We still have more ICU beds than we normally would, that we're normally staffed for. And we also have surgery beds that have COVID patients in them. So, we're watching and waiting to see what happens after the holiday gatherings, to see if we're going to have any other types of surge or if it's going to continue to decline. So it's very much a watch and wait situation. So we want to be prepared for any event. And it's a daily conversation to talk about where are the numbers going, what are the projections that we're seeing, and so that the system can respond and make sure that as many services that have been decreased, like home care and surgical services, that we can really start to increase it, because we do appreciate the impact that people feel waiting for these procedures and this support.
From the Winnipeg Sun, Scott.
Good afternoon to both of you. Scott Bill, Winnipeg Sun. First question, Dr. Roussin, you spoke a little bit about this, about some of these businesses that are planning to, or considering or planning to already have reopened despite public health orders. And you kind of gave a message there, but I guess, some of these businesses are on life support. Some of them are, contemplating bankruptcy, might have no choice in that. I guess, and I know these restrictions are in for 2 more weeks, but the ask the whole time has been, hold out, do the best you can, that sort of thing. I guess, what is the messages for businesses that are facing the choice of either going under completely or risking a fine by opening?
Yeah, I mean, the message is definitely that it's that I think everyone can see how challenging this has been, especially for businesses that are facing dilemmas like you described there. The message from me has to be, don't violate the public health orders. I can't provide a message other than that. Certainly ensure you're taking advantage of any opportunities that are available in the short term, and knowing that we've done this for a reason. We can look at other jurisdictions right now and see that our trajectory is going in the right direction. We see other places that have to have even more restricted public health orders than we even have right now. So we're really going to try to do what we can to start easing these restrictions as soon as we can. We're going to engage Manitobans now, but there's probably not much that I can say that would, make a business owner in those circumstances, feel good right now. So that's certainly understandable, but the message has to be that the public health orders are in there for the protection of all Manitobans.
Thanks for that. Early on, back in November, even early December, I believe, our community transmission in Winnipeg was, roughly 50%. How far has that number dropped in recent weeks?
Yeah, it's continues to drop. I haven't seen as in a percentage form this week, but it has continued to decline. We're again seeing the majority of cases as household contacts we see right now, and that's really a function of of the restrictions, right? There's limited places to acquire it. And so it's really the hard work of Manitobans staying home for the most part. And then we'll see some of the increase in the proportion of cases related to gatherings in the upcoming days to weeks because of that holiday season. But I think that the community-based transmission has diminished over time.
Thanks for that. And my follow-up is, I believe the latest numbers out of First Nations is something around 60% of our active cases come from First Nations. Should there be more of an emphasis, I suppose, on vaccinating that population as quickly as possible? I know obviously healthcare workers are at the top of the priority list, but secondary and obviously PCH residents as well. But just given what this disproportionate amount of cases, given the population size, should they be the next on the list in terms of getting as many vaccines to those communities as possible?
So you do need to consider things like your epidemiology when you're prioritizing groups. We have worked with First Nation leadership and clinical leaders, and so as you know, we've gotten Moderna vaccine out, and it's being injected in communities now. So I think we have been prioritizing that group, certainly in community, high-risk members in communities. And then we'll continue to see, right? Most of our issues right now are vaccine supply. We have seen, increased proportion of cases in Indigenous, urban individuals as well as populations like the sheltered population. So these are all things that we'll consider. But again, our most pressing issue is vaccine quantity right now.
From CBC Radio Canada, Gavin.
Hi, Gavin from Radio Canada. Dr. Roussin, what should we make of what appears to be a pretty big drop in the daily numbers in Winnipeg? And it does seem this has been going on for a while.
Well, I think it's like I said, I think we can be cautiously optimistic. I think this is a result of Manitobans' work by following the very difficult public health restrictions that are in place. But I think it's evidence of the effectiveness of those. We see the effectiveness in other jurisdictions. So I think we're cautiously optimistic. We've seen the trend in the right direction. We can't say we're out of the woods because we have nearly 3,000 people in self-isolation right now just from holiday gatherings alone. So there's going to be a proportion of those people still to come as cases. And then we know how this virus is transmitted, right? When we have restrictions in place, we see cases going down, and as we open up, we see them go up. So we're going to have to be very cautious as we begin to reopen things, because we just know the more people engage, the more people gather, the more transmission of the virus we'll see.
There is an outbreak in Lynn Lake, which is the northernmost community accessible by all-season road in Manitoba. I think last update I saw there was about 24, 25 cases and one death. I'm just wondering if you could provide an update on the situation there and tell us how concerned you are about it.
I don't have any specific numbers to provide. The concern with, again, when we're talking about more isolated communities is just access to healthcare, access to alternate accommodations. But there's been a lot of work with, with the region, public health in the region going on now with the contact tracing and isolation and testing. So the typical public health response and outbreak response is ongoing. But you do see challenges when you have communities dealing with outbreaks that are remote or isolated.
Finally, could you just provide an update on the rapid testing program for teachers? What's the uptake like?
Well, this is yet to begin. We still have plans on implementing that in the near future, and so we'll be able to provide updates once we have that rolling.
From CBC Manitoba, Bart.
Hey, Dr. Roussin, given that we do have consistently now capacity to test more people with those lower testing numbers you were just speaking about, when can you open that up to more asymptomatic people or more targeted testing in places like schools and workplaces?
So a couple of things. So we are seeing testing numbers below the capacity we have. So one thing is to save some of that capacity for times that we might need it. So we don't have to use up feel we need to use our capacity if we're not seeing it as beneficial. I think targeted asymptomatic testing in certain groups could be beneficial. And we continue to look for where that might be a benefit. And then opening it up to, different locations is a different story, right? Like our capacity is at the testing sites. So if we want to utilize that capacity, we have to bring those people there. But yeah, I think there are ongoing reviews right now to see whether we want to open up to certain asymptomatic testing. You see, we've done that with returning travelers as a targeted approach, and we'll continue to look and see if there's any further benefits.
I know that some healthcare workers started getting some antibody testing earlier in the year, small numbers. Where are we at right now, epidemiologically, with the antibodies that you've seen, antibody testing numbers? What can you tell us? What do we know about the prevalence of the virus this year, over the past year, beyond the case numbers as a result of antibody testing?
Yeah, so we can't say anything definitive. Just like any respiratory virus or pretty much any infectious condition, the number of true infections is always going to be greater than the amount of diagnosed tests, and that's for a number of reasons. Asymptomatic people or people who are symptomatic who just didn't go for testing. So we will see that when we do seroprevalence studies, we're going to see that prevalence as much greater than the actual diagnosed cases. And there's a large range. I've seen numbers from 3 times to 8 times. Right now there's more of a national approach to this to try to get a good, the key is to get a very good random sample. The testing that we've done now is not really true random samples, so it's hard to make conclusions on what the actual seroprevalence are. But we'll continue to follow it over time. I should note that right now we still have very minimal, if any, use of antibody testing for clinical practice. We can't rely on that to say somebody is definitely immune to the virus. So there's a very limited need clinically to be testing for antibodies.
All right, then. Given the shift of the burden of the active caseload to First Nations, what policy changes can be made beyond vaccination to deal with the fact that we have 3 of our 4 active case districts with the most cases are way up north?
So a lot of this has been addressed right near the before the pandemic even got here with planning, with the working with First Nation communities and leaders to plan the pandemic response. We have our rapid response teams right in these communities. We've had the travel restrictions in place in the northern Manitoba to try to minimize the importation of the virus into those communities. And then there's a lot of work done on expanding the access to alternate isolation accommodations as well. So there's been a lot of work done. And then, as you mentioned, in addition to that, now we're starting to roll out vaccines in these communities.
From the Canadian Press, Steve.
Dr. Roussin, you touched on this earlier, but the test positivity rate has dropped, but it's still quite high at 10%. And I know you said it's because there's a lack of flu, regular influenza season, and fewer people are going to get tested. But should this not still be a worry considering World Health guidelines? Is this 10% not a reason to sort of keep the foot on the brake?
I think it's still a concern. We would much prefer to see that test positivity dropping down. Again, even from the WHO, these guidelines are really put in place with a some degree of uncertainty, right? No one knew what to expect with this second wave. So we're seeing now that there's very little transmission of other respiratory viruses right now in the community. So people who get sick, it's COVID. So in that sense, the test positivity, we would expect it to stay relatively high. But certainly we're still concerned with that. We'd much rather see that number come dropping down much quicker than it is.
And you mentioned the NHL earlier. Are you in talks with other leagues such as the Western Hockey League about a plan to reopen there as well?
Well, we're in contact with other types of leagues have contacted us for discussions. We don't have any immediate plans on allowing a return to play in those areas. Right now, our public health orders exempt professional hockey teams.
Okay, and the final question, something the public may not fully understand, or at least the wide, everybody in the general public. It's now roughly 2 months after Code Red was instituted, and we've seen the case numbers drop into December, a little spike after Christmas, they're dropping again, and the hospital numbers take much longer to drop, and we're seeing them drop now. And so it's a bit like turning around an ocean liner, where it takes a long time to have that effect roll through. So what do you say to Manitobans who say, well, we're still seeing cases, and it's been, we've been under these orders for several weeks now?
Yeah, and I think it's the expectations of that we have to be aware of is that this second wave was, quite severe throughout the world, in many parts of Canada, and a lot of that deals with it's only COVID that's circulating, right? We're just not seeing any, every year we see, this many respiratory illnesses. I don't know for sure, but I would imagine our test positivity for all respiratory viruses is greater than 10% this time of year all the time. It's just that this year, we're only seeing COVID. And so we're going to continue to see cases of COVID. We have to expect to see cases of COVID. But again, the fundamentals that are in place are, we really want, to avoid that single case of COVID exposing, 20, 30 other people. We want to limit the transmission of this virus, bring that R number down below 1 so that we can continue to see a decline. And then, like you say, there's always going to be that lag in hospital numbers. The average length of stay right now is about 14 days, so we're going to see at least that. And then, of course, that's an average. There's a number of people who stay much longer than that. And so we still see that strain on hospital, although the hard work of Manitobans have allowed us to return to at least some of the surgical activity.
Our final reporter this afternoon from the Thompson Citizen, Ian.
Good afternoon, Dr. Roussin, Ian Graham, Thompson Citizen. I just wanted to go back to the Lynn Lake for a second. Is there any idea of what, the number of cases doubled since Friday up there? Is there any idea of what's behind the increase? What's the source of infection?
Well, I can speak to the source of infection. When you're in a remote or isolated community, transmission can take place rather quickly. When you look at a doubling of numbers, often that's a bit of an artifact, because once we get concern of a outbreak, then we bring up resources and do much more testing in that area. So we end up finding a lot of cases quite quickly, which is what we want to do, because then we isolate those people and can do contact tracing. But a lot of times when you see a very quick doubling, it's because of the work of the teams on the ground to rapidly find cases.
Okay, thank you. The next question, for the past 5 days, new cases in the north are 25% or more of the new cases reported. What are the factors? Is it backlogs of rapid tests, or gatherings, or just outbreaks in places where it's hard to effectively isolate?
Yeah, and so there's a number of communities that are dealing with outbreaks right now. So that's what's driving those numbers up, and we know the challenges in remote isolated communities with crowding, sometimes difficulty to be able to isolate, and so we knew from the beginning that there's a real susceptibility in these communities should the virus be introduced, and we're seeing some of that right now. But there's a lot of work being done to identify cases, to isolate contacts, and to ensure people have access to health care.
Okay, thank you. And just lastly, right now, the number of active cases in the northern region is roughly a third of all the active cases. Is that 1,100 and some number of active cases? Is that accurate, or is that probably higher than the actual number that are still infectious?
Yeah, it's a bit of an overestimate, and for the same reasons, the focus right now is on case identification, contact tracing, and isolation, rather than closing down the numbers of people who have been recovered. So it's an overestimate, but we have things in place this week, and next week we're going to continue to try to bring down the reported active case numbers to more accurately reflect the actual active cases.
Thanks, everyone. This concludes our media briefing.